Hello guys, so today we are going to discuss on corneal ulceration, also called as ulcerative keratitis. So what is corneal ulcer? It is a deeper erosion through the entire epithelium and into the stroma. You might know that cornea is consisting of 5 layers, which are epithelium, Bowman's membrane, corneal stroma, and Descemet's membrane and endothelium. So up to corneal stroma there is a deeper erosion through the entire epithelium and the stroma, which results in corneal ulceration. So what causes corneal ulceration? The most common cause in dogs and cats is trauma. Ulcer may result from blunt trauma, or it can occur due to chemical burns of the cornea, chemical substances like shampoo or drywall dust, etc. The bacterial etiology consists of Staphylococcus, Streptococcus, Pseudomonas, and the viral etiology consists of herpes virus infection. Some diseases are genetically predisposed for corneal ulceration due to weakening of the cornea, as in boxer breed, due to epithelial dystrophy, which leads to weakening of the cornea, which can predispose for corneal ulceration. Keratoconjunctivitis sicca, in which decreased tear production leads to drying of the cornea, which irritates the cornea and may lead to corneal ulceration. Endocrine disease such as diabetes mellitus, Cushing disease, and hypothyroidism can also predispose the animal towards corneal ulceration. So, what are the clinical signs we will observe in corneal ulceration? First of all, you can see the ulcerative lesion, and then the vision of the animal will be blurred. Fear of the light or photophobia can be seen. Redness and eye swelling and discomfort to the animal is obviously noticed. Due to this discomfort and pain, animal blinks eyes excessively and it may close completely its eyelids. Or you can see the sclera becomes very red and it is swollen. The front of the eye becomes hazy or cloudy, and you can see the excessive tear production. Or in case of tear deficiency, we can see the discharges become thick and mucus ranging from clear to white or yellow color can be seen. So how you will diagnose a case of corneal ulceration? So for the diagnosis of corneal ulceration, a test called fluorescein stain test is used. A drop of stain is placed on the cornea. The dye will turn up green and adhere to the areas of ulceration, as you can see in this picture. So this is the corneal ulceration. So what other diagnostic methods can be used? General eye examination tests like palpable reflex, Menas or blink reflex can be used. PLR or pupillary light reflex can be used. A cotton ball test can be used. So what treatment we can suggest? Medically we can suggest to treat the etiology, such as a dry eye or KCS should be addressed. Entropion condition, which is nothing but the inward deviation of the eye lid, should be corrected by surgically method known as hot Celsus procedure. In fact, for infection we should give antibiotics. For bacterial infection we should give antibiotics. Broad spectrum topical antibiotics should be used. We should reduce the tear protease activity by EDTA, serum, acetylcysteine. So serum contains alpha 2 macroglobulin, which works as anticollagenase. Combined with antibiotic and protease inhibitor therapy, we might improve the clinical results of the disease. One thing should be considered in the treatment of corneal ulcer is that we should never topically use steroid, because it will cause scar formation. We can also give a new treatment called PRP, platelet rich plasma. The plasma of the animal is centrifuged and can be used as an eye drop, which give good result in corneal ulceration. Generally used antibiotic in corneal ulceration are ciprofloxacin, moxifloxacin, tobramycin, erythromycin, gentamicin, etc. Topical NSAIDs for ophthalmic use are flubiprofen, suprofen, and diclofenac. So the surgical treatment. We can for corneal ulcer we can use three types of surgical management. One is keratoplasty followed by temporary trachytherapy, second is membranoplasty, and third is corneal debridement, and we can use bandaged contact lens. So coming on to conjunctival flap autograft, also known as keratoplasty. In this we use the we use the conjunctival flap, and then we suture that flap over the other part of the conjunctival membrane, and then by this we cover the corneal ulcer, and then we close the eyelids by temporary trachytherapy. Second surgical management is by corneal debridement. The base of the corneal ulcer is debrided and loose corneal epithelium surrounding the edge of the ulcer is also removed, as you can see in this picture. See, this is the debridement of the ulcer. We can also use a method called membranoplasty. What advantage it is having, that it reduces the frictional irritation and desiccation and probability of the further damage to cornea, and also it promotes in healing of the corneal lesion. This is the third eyelid which is covered over the corneal ulcer, and as I told you, we can also use bandage contact lens. So a soft contact bandage lens could form an adjuvant therapy in case of corneal ulceration. So let's discuss one case here. So what happened? A Shih Tzu female, 5 months old and weighing 3 kg, was presented to clinics having a history of discharges since 1 week, and they used previously human eye drops. The thing is there was regular history of deworming and vaccination, so we can eliminate herpes virus. There was normal feed and water intake, normal urination and defecation, and normal on clinical observation. What we noticed was in the left eye there was a negative menials and PLR reflex, and we also observed that corneal edema in the left eye and opacity was noticed. So we did a fluorescein dye test and it was positive, and we also did Schirmer tear test to assess the tear production. Normal tear production should be around 15 to 25 mm per minute, so it was in normal range. So we provided a treatment plan for this pup. We advised orthoprost eye drops, 1 drop BID for 7 days. It consists of bimetoprost, which reduces ocular hypertension. We advised Cory's eye gel, 1 drop TID after 1 hour gap for 1 month, which consists of hydroxypropyl methylcellulose. Also, we advised Optocare MKT, which consists of moxifloxacin, keratolac, tromethamine, which consists of antibiotic moxifloxacin and NSAID keratolac. We prescribed a multivitamin injection, Helovit, which 0.5 ml IM, and also we gave injection Melonex 0.1 ml subcutaneous. We advised a deep TBI tablet, which consists of trypsin, bromelain, and rutoside, which reduces the inflammation. And we also advised a syrup Hachmavet, which consists of Ayurvedic anti-flatulent medicine. So follow up, after 2 days owner brought the pup for follow up, and there was no improvement in the condition, and owner said that there was bloody discharges in the left eye were noticed. Same menas and PLR and palpebral reflexes were negative, and we can also see that protrusion of eyeball is also there. Exophthalmos was also noticed in the left eye. So we advise for temporary trachytherapy for this case. The pup was presented to the clinics with fasting of 12 hours next day, and we did the temporary trachytherapy under sedation. We gave injection buterphenol 0.2 mg per kg IM, injection xylazine at the rate 2 mg per kg IM, and injection diazepam at the rate 0.2 mg per kg. So the procedure followed was a polyamide 30 suture material for temporary trachytherapy was used. Suture followed was horizontal suture pattern, and a small plastic tube was used to relieve the tension over the area. As you can observe here, this is a small plastic tube which was used to relieve the tension over the eyelid. Post-operative treatment was Melonex was given antibiotic amoxicillin was given, and injection of ivermectin was given, and we advised tab opticet 1/4 SID for 5 days, which consists of lutein, vitamin, and carotenoids. We advised drop fluoride, which consists of flubiprofen 3 drops QID for 5 days, and we advised drops opthovet DT, which consists of dorzolamide, which reduces uh, ocular hypertension. It is a kind of diuretic. We advised Optocare M, which consists of moxifloxacin and syrup amoxicillin 0.8 ml BID for 3 days, syrup Setwell 0.5 ml BID for 3 days.